Good afternoon, everyone. County Executive Pat Ryan here on another beautiful spring day. Thank you for taking a few minutes to catch up with us and hear what's going on in our effort to finally get through this pandemic, to get everyone out healthy and safe. And I really do feel like we are continuing to make significant progress each and every day. We have more work to do, but each day I am feeling more optimistic. I think particularly because this morning I spent some time at our vaccination pod out at the Hudson Valley Mall. Every time I leave there, seeing folks get the life-saving vaccine, I feel even more encouraged about the progress that we're making. So it was a good morning to be out there. Looking at the numbers, another major reason to feel positive in the last 48 hours is that thankfully we've had no fatalities of Ulster County residents. So that is the most important metric and statistic, and I'm glad to see that that is holding steady. Total cases, 13,680. Total tests over 330,000, and 11,708 have recovered that were previously positive. Hospitalizations, that's the one metric that's a little cause for concern. That number is up to 16. So 16 currently hospitalized in Ulster County. One of them in an ICU bed. That's up 5 in just the last 48 hours, so that's something that we're going to watch. But we generally think that's within the general kind of trend we've seen of around 10 to 15. But hopefully we can get that number down. And as always, those that are so sick that they have to be hospitalized, we send our love and our positive energy to each of you, especially the one individual on the ventilator right now. We're thinking of you. Looking at the active case count, this is looking at least good in that it's about flat and staying on the plateau that we're on. So that is the good news, that we're at 1726 today. That's down about 20 active cases from 48 hours ago. But that is much, much higher than we can accept and that we can maintain. So we have to get through this plateau that we've been in now for almost a month and figure out how to get the curve fully down, coming off of the second wave that we had at the beginning of the year, end of last year. The new positive test rate and new positive cases, this is also still remains higher than we would like, and that is part of why we continue to see the active cases up. In the last 48 hours, we are at a 4.84% new infection rate. That means that of the 32 tested, so 3,432 residents tested, 166 new positive. So once again, 4.84% for new infections over a 48-hour period. Much too high, although it is down from the worst a few weeks ago. We have to get that new positive rate down, or else it all kind of flows from there in terms of active cases, hospitalizations, and unfortunately fatalities. So please continue to treat the pandemic with the seriousness and the vigilance that we all know is required, even though it's been a long year plus of following those precautions. Hospital capacity, we're in good shape here. You can see the current numbers again, 16 hospitalized, more than sufficient capacity. Thankfully, we just don't anticipate this will be a concern, but we continue to, of course, monitor it and track it. With the nice weather and all the progress, again, a reminder that we are not through the pandemic, that the emergence of different COVID variants, which our health commissioner, Dr. Smith, talked with us about 2 weeks ago, that trend continues and is accelerating. We know, for example, that in New York City, based on City Department of Health data, over 70% of their new cases are from one of the multiple emerging COVID variant strains. It's safe to assume, although we don't have the same rich data for our county, it's safe to assume that a significant percentage of our cases now are one of the multiple variants, in particular the UK variant, which is the most prevalent in the New York City area and likely the most prevalent in the Mid-Hudson region as well. So what that means is because they are more contagious, That is why it's easier for them to spread, why we're seeing the positivity rates where they are, even as we make tremendous progress on vaccinations. We're still at a very delicate point where we are over 40% vaccinated, but that means that 60% of our residents are not still vaccinated and therefore are able to continue to spread COVID. And so we have to stay vigilant. We have to wear masks. We have to maintain social distance, avoid those group gatherings until we can get the vaccination numbers up, and continue to wash hands and use hand sanitizer. In terms of progress, in terms of progress on vaccinations, as I said, this continues to go well and really be the reason for lots of hope and optimism as we really fully come into the spring now, into April. Earlier this week on Tuesday, across New York State, I'm sure everybody's aware now, eligibility was significantly expanded. So now every single New York resident 16 or older is eligible for the vaccine. That is good news. It also means we've had a significant uptick in the number of people signing up for appointments. We're doing everything we can to continue to meet that demand as the supply also picks up. But for example, this week, and I'll talk more about this in a minute, but this week all of our county pod appointments are now filled, although we will surely get as much or more vaccine next week, and of course continue to push to get more each and every week. But please spread the word, again, for anybody that isn't tracking, because I know it's been an ever-changing thing. Everyone 16 and up is now eligible to be vaccinated in New York State. For this week, as a reminder, Ulster County was allocated 7,700 vaccines. That's in addition to just shy of 6,000 doses that are administered at the New York State-run site at the Ulster County Fairgrounds. So between those two, again, we're right around 14,000 plus total doses being administered in Ulster County this week, and we anticipate that that will continue and hopefully even grow next week. We're also continuing to push for more Johnson & Johnson specifically, given that one dose versus the two doses makes it much easier, especially for folks that are homebound or others that are harder to reach. If we can use the Johnson & Johnson for those folks, those populations, that is our intent, and we are pushing for as much J&J as we can get. There's been a national shortage of J&J due to some of their supply chain disruptions that I'm sure many of you are aware of, but we are doing everything we can to get it here as soon as possible. Vaccination locations this week remain the same as Tuesday. We have our Ulster County pod site operating today, as I said, all day today, all day tomorrow. Our other partners, I want to thank each of them across the county that are getting hundreds and thousands of additional doses out. Our medical providers, pharmacists, hospitals, and as well as the SUNY New Paltz health team, all doing our part to get shots in arms, as they say. Every single person that's vaccinated means all of us are safer, so that is good news. I want to take a minute and talk just about some of the numbers and actually really in the midst of a huge effort, which we still have much more work to do, but in the midst of it, just take a minute to appreciate and thank all of the team, the county team, the state team, all of those providers and partners I just talked about for the work and the milestones that we are achieving. In Ulster County, as of earlier this morning, we crossed a major threshold. We're now 40.6%, over 40% of our residents in the county have received at least their first dose. We didn't realize this until we looked, but that actually makes us the highest percentage of residents vaccinated of any county between New York City and Albany. So that is a huge credit to, again, all the team that are out there working their butts off to really not only vaccinate folks, but to get the word out through our vaccine distribution coalition that's been highly effective. Our UCAT team that are giving rides to folks, our Office for the Aging that are working with our seniors, so many more folks that are mobilized to make people aware, to get them signed up, and ultimately to get them out there and vaccinated. So thank you to everybody. We're going to bring that same level of energy and focus and even up it as we now shift into getting the remaining 59.4% of our population vaccinated. I recognize it will be harder to do the second half, and so we are continuing to adjust our strategy and implement new approaches and ideas. If you have ideas for how to do that better or how to reach certain populations that aren't getting reached, please don't hesitate to reach out, because we're open to all ideas to get this done as quickly and safely and equitably as we can. The exact numbers, as we always do on our vaccination progress, you can see here. Just shy of 44,000 people now have received both doses, which is incredible. 72,496 have gotten at least their first dose. And once again, that puts us at 40.6% of Ulster County residents that are now at least have begun the vaccination process and gotten their first dose. What can you do to get vaccinated for yourself or your loved ones if you have not done so already? The simplest thing is to go to our website, vaccinateulster.com. You can sign up for our pre-registration list, and that's really kind of an information list as well. So once you sign up there, anytime there are open appointments, you'll get email notifications about that. So that way, if you don't want to have to constantly check the site, you go to vaccinateulster.com, you sign up for our pre-registration list, and then you'll get those email updates every few days when those appointments open up. The other thing you can now do, we do have any open appointments are directly right on that site at the top of the site. So any day or hour or minute you want to check, you can go to vaccinateulster.com. You'll see the pods that we are running. As I said earlier, unfortunately for this week, for today and tomorrow and the rest of this week, our county pods are full and fully booked up, but we expect to have many more next week, so please continue to pay attention there. You can also go to the New York State site to sign up for their for this at the state-run vaccination site. The state is able to book out a little bit further because they have more predictability into their supply. Unfortunately, we at the county level and our partners are still only getting a week at a time. So we are trying to get a little more visibility into that. But for now, it's kind of, we learn at the beginning of the week what we're going to get. We put up the links and then we share them. And so with what we have, we're letting you all know as soon as we know, believe me. Again, please tune in for that. For those that might have transportation barriers or issues, I just want to remind everyone, we are now offering through our Ulster County Area Transit team, which covers all of the county, free rides for anyone in the county that needs to take our bus service to the vaccination sites, to any of our county sites. So if you're getting, all you just need to do is look at what routes would get you there on the UCAT page, or you can call them, and then when you get on the bus, just show your appointment, and it'll be a no-charge ride to get you to the vaccination pod. I actually rode one of our buses this morning, courtesy of our great UCAT team, and those are running constantly throughout the day. So please think of that as another opportunity, and hopefully making it a little bit easier to get to our vaccination site. In particular for seniors and those that have disabilities, we can also work with you to do a curb-to-curb or door-to-door kind of a ride if you're not able to get to one of the standard bus routes or bus sites. So if you are a senior or have a disability, you can call our UCAT directly at the number on the screen. That's 334-8120, 334-8120. You just need to give them 24 hours notice so that they can plan that into their route. But again, if you or a loved one need that curb-to-curb service, please call that number and we'll get you set up with that. Finally, we're going to be continuing to run these pods, and the only way we make that work is with some of our community volunteers. Was out there today visiting with a lot of our great volunteers, and I really have to say we just have an incredible team of folks that have mobilized to make our operation work. One of the folks I was talking to this morning said she had retired a few years ago and said, I think this is the most impactful thing I've ever done in my life, volunteering at one of these sites at this moment. So if you want to have that same feeling, you can join our cadre of volunteers. You can sign up at ulstercountyny.gov/volunteer. You will receive a stipend for any and all of our volunteers. And I also want to give a special thank you to our Congressman. Congressman Delgado joined us this morning and was volunteering as well, helping to do patient flow along with me, making sure that the site is running smoothly. And so I want to thank you, Congressman, for joining and doing your part to help our vaccination process run smoothly. Again, please sign up if you're able. Thank you to each of you for tuning in and staying engaged and positive through this last year plus of COVID. Thank you to all of our frontline workers that are continuing to do their work despite risk to themselves and their loved ones. And really thank you to everybody that's made it through one difficult year. As the spring comes, I think we're all feeling better and more optimistic. I know I am, but we will be with you all through however long it takes to get through the end of this, as well as to help our whole community, especially those most impacted and those most vulnerable, to help us dig out from the impacts of the pandemic. Anything you need between now and our next update, you can call our Recovery Service Center. That's 845-443-8888, 443-8888, or drop us an email or go on the website. Our next update will be on Tuesday afternoon at 3 p.m. In the meantime, hopefully the weather holds like this. Hopefully you can get outside safely and enjoy some activity and time with loved ones. Please do continue to follow those precautions. I know it's tough and it's been a long time of doing it, but let's just keep our vigilance up a few more weeks and months until we can get the rest of our folks vaccinated, and then we can all breathe a little bit easier. So thank you, stay safe and healthy, and be resilient, and I will see you in a few days.